Hi guys, just somewhere en route to Birmingham, I think. We're on some motorway, I'm not sure which one, but we ran a course yesterday and someone asked me, do we always need to do ICE in our consultation? This is really important when it comes to CSA, stage 3, PLAB 2, do you always need to do an ICE? Now, I suppose it goes back to what is ICE all about? ICE is all about understanding the patient's mind. So if you think about the question, do I always need to understand the patient's mind? Then the answer usually is yes. ICE is just a tool, isn't it? It's one of the ways that you can try to figure out what's going on in the patient's mind. Because remember, you can diagnose the problem, you can treat the problem, but if you haven't understood what's going on in the patient's mind, then they're probably going to walk away with questions there and doubts there and things that you want to understand and manage as well, so that you can have a rounded, complete consultation. So ICE is just a tool to understand the patient's mind, and I always want to understand the patient's mind. Of course, there are a couple of scenarios like a real emergency where someone is obviously really unwell and you have to go in there and just do pure medicine. That's fine. I wouldn't worry about understanding the mind then. But pretty much 95% even, I would say, of consultations, I want to know what is going on in that person's mind because it impacts what I do in the second half. So if you ask me the question, should I always do an ICE? I would say almost always, but the principle you're trying to do really is to understand the patient's mind, and ICE is just one of the tools to do that. Does this make sense? We work on ICE and a lot more of this type of stuff on our CSA, our PLAB 2, and our immersion stage 3-day courses. So have a look at the website, Arora medicaleducation.co.uk to book onto one of those. Hope this helps. #CampAsWillPass, #I went with Arora.